Newsfeed Now. Coronavirus facts, not fear, begins now.
All right, good Monday morning. Thank you so much for joining us for Newsfeed Now. I'm your host, Aaron Nolan. The global pandemic continues, and here in the United States, we're entering what I think is really our second wave, as the president now has lengthened the social distancing and the isolation to avoid the spread. We've got more on that coming up as we go live to Washington, D.C. We're going to end the show with a happy note. It's a wedding that went viral because, in fact, it was viral. I'll explain it to you, but we start with breaking news, starting with the latest numbers. This is from the CDC. Over 140,000 cases of COVID-19 are now in the United States. Leading the world in cases is the U.S. The death toll is at more than 2,400 deaths. New York continues to be the state hit hardest. Looks like, is that 40,000, Matt? 60,000 in New York. Globally, the virus has infected more than 723,000 people worldwide and killed over 34,000, according to Johns Hopkins University. A Navy hospital ship arriving in Manhattan this morning is expected to provide relief to the city's overwhelmed hospitals by freeing up beds so they can treat the coronavirus and the patients. It's 1,000 beds, 12 operating rooms, a medical lab, and more than 1,000 Navy officers will treat patients who do not have the virus. It is expected to begin receiving patients tomorrow. New this morning, 1 week after the Olympics were delayed, we have a date. July 23rd, 2021 will be the opening ceremony. The games will run from that date until August the 8th. This gives athletes a timeline and, more importantly, an exact date to begin training. A lot of folks talking about this next one. Americans could see checks from the historic $2 trillion stimulus bill direct deposited into their account within 3 weeks, according to the Treasury Secretary. But experts warn it could take longer than that. Back in 2001, it took 6 weeks for the IRS to start sending out rebate checks under a new tax cut. And in 2008, it took 3 months after a stimulus package was signed into law to get that money. As social distancing around the country continues and cities continue with curfews, the president had hoped to have the country back open in a couple of weeks. The thought? Church services filled on Easter Sunday, but that has now changed. Social distancing guidelines have been extended by President Trump until April the 30th. Health officials say people still need to maintain a safe distance from one another. President Trump says the country's death rate may peak in about 2 weeks.
Given that you're announcing that you're extending these guidelines, was floating Easter a mistake, do you think? And
no.
Does this? Can you tell us why? And then
it was just an aspiration. That was aspirational. We had an aspiration of Easter, but when you hear these kind of numbers and you hear the potential travesty, we don't want to do anything where, we don't want to have a spike up.
Let's bring in Jesse Tenor live from Washington, D.C. Jesse, you heard the president over the weekend. You've heard these numbers continue to come in. Right now, again, isolation continues until middle of April now, late into April. What else are you hearing from Washington as this pandemic continues to worry and change our lives?
Yeah, so right now, right after the House last week in kind of a dramatic fashion did end up passing that $2 trillion relief package for the coronavirus pandemic, and the president signed it. A lot of lawmakers went home, but that doesn't mean that they're stopping work on a next round of relief. And so that's already in the works right now. You mentioned those checks, Aaron. Of course, that impacts really the most Americans. And so obviously, yeah, people are keeping a close eye on that. We're hearing that there could be another round of checks coming if lawmakers see kind of the success that these have had. So there could be another round. That's what Democrats were trying to push in this round, but so we could see that again. We could also see some pension protections, some major infrastructures. Some Republicans were trying to get that in this round, and so we could see more developments with that. But yeah, that social distancing, I guess, call that you mentioned from the president, kind of backtracking and saying, hey, Easter would have been great, but let's go to the end of April, is really just showing too potentially how Congress could be gone that long as well.
Jesse, this is no doubt a government issue, and that's something I think a lot of us tend to forget. I mean, we are stuck inside our homes. We are trying to run around our yards to keep our kids busy. We're doing anything possible. But on the government front, there's a lot going on. Not only is there the stimulus package, there's also the thought of trying to get more testing. There's also the thought of trying to get relief for our healthcare workers. Can you put into words how active Washington is right now amidst what is going on with COVID-19?
Yeah, so right now there is a lot of work to be done, but it's just not happening in the offices that you usually see it happening in. The offices are very sparse right now too, just like all of us in newsrooms even. And so there's having to be a lot of things happen more on the phone, definitely less in person. But yeah, things are still moving. It's just happening in a different way, and people are still trying to kind of get used to these new schedules and new ways of really crafting policy.
All right, Jesse Tudor reporting for us. Jesse, thank you so much. I saw this news yesterday, and it got to me. Grammy winner Joe Diffie has died from the coronavirus. This is like one of the first really big names to die from this. I'm playing some of his music on computer too, Tim. He was great live in concert. This is one of my favorite songs from him, Pickup Man. He also had John Deere Green. Diffie was a Tulsa native and a member of the Oklahoma Music Hall of Fame. Joe Diffie died from the coronavirus. Interesting stuff there. The organization behind the Emmys and Golden Globes are changing rules due to the pandemic. The Television Academy is extending its Emmys eligibility date for hanging episodes. It's also revising the voting calendar and suspending some events. The Hollywood Foreign Press Association is relaxing the screening requirements for the Golden Globes. Screening rooms and theaters are closed in Los Angeles, so the association says applicants can submit links or DVD copies of the film. Also, the movie industry continues to evolve. In fact, I was just looking recently, as this morning, trying to figure out when the new Trolls movie was going to come out. My kids love that movie. It's actually going to be available. You can rent it directly from your TV. I think it's $20. That's going to happen next weekend, so I'm looking forward to that. Toilet paper, hand sanitizer, paper towels. Those are all the things that we can't find on our shelves. But the medical field is also having a hard time with supplies, so much so the U.S. Food and Drug Administration has approved an Ohio-based nonprofit's request to begin sterilizing surgical masks for reuse. This could be a game changer in the fight. The nonprofit has made systems that are able to decontaminate those masks. At first, the FDA was only allowing 10,000 masks a day and only to be used in Ohio. But the nonprofit says each system can now do 8 times that, 80,000 masks per day. And now the FDA is allowing it.
We have a solution, at least for part of the problem, in that we can clean 80,000 of these every single day. Free us, let us go do it. That's the message. And sometimes you just have to say it that way to get things moving.
Christine Marconi now joins us from Columbus, Ohio. Christine, obviously, you talk about game changers. You talk about things that need to happen when we need them to happen. I'm sure for you guys in Ohio, this is one of those that needs to happen now, and it could stretch for the rest of us in the United States.
Yes, our governor yesterday, he wasn't going to hold a press conference, but he did, calling it an emergency. They kind of were in talks with the FDA, Battelle and our state governor, talking about getting this approval. At first, the FDA came back and they only allowed approval for 10,000 masks to be sanitized in Battelle's machines, but their capacity is 80,000 masks. So they were wondering why that was, where the disconnect in the numbers were. And they went back and forth. Our governor was very visually frustrated as we've seen him in this entire process. But they talk about this technology, and it's actually really cool. It all starts with hydrogen peroxide, and then all these hospitals, they collect the masks and they get wrapped up in bags before they are shipped to Battelle, and they go in a second bag, get wiped down with disinfectant, really high technology that they've been developing for a few years. Battelle loads them into these giant shipping containers that you see on trucks and ships. It disinfects them, they dry out for a few hours, and then they ship them back to the same hospitals. So it is, like you said, a huge game changer, because in Ohio we have 2 of those machines, so we're able to do here now, after the FDA approval, 160,000 masks per day. I know there's another sanitation machine on its way to New York City right now, as well as other cities around the country. So not only here in Ohio is it going to be a game changer, but all over the United States, and hopefully very, very soon.
All right, curious question, Christine. I don't know if you could answer this for me or not. Are masks used once daily? Are they used once per patient? How often are our medical personnel wearing these masks?
Now, normally, from what we've heard from doctors, normally they would see them once per patient. They would go into a patient's room, the doctors, the nurses, and then they would toss them. But with the shortage, they've been having to reuse them, which, you know, is making them uneasy. It's not exactly the most sanitary process that they had been having to do, especially in places like New York, where they're really, really having struggling with this issue right now. But hopefully, this new technology, amazing technology from Battelle, can help eliminate some of that and hopefully keep some of our doctors and nurses from becoming sick themselves. Well,
and I think that's a good point. We've got to protect those healthcare providers. I was watching something over the weekend, and it was saying that these are our frontline fighters right now, or our healthcare workers. Absolutely. We've got to find ways to keep them safe. Finally, for you, you've been talking about this Battelle. Do they have the capability in order to create more of these systems to get to other hard-hitting cities, and maybe every city in America by the end of this will have one of these, so that our future is brighter than what we see it could be right now?
That is definitely the hope. They're trying to get one. I know they had one on the way to New York. Hopefully it'll be there very soon if it's not there already. Louisiana, Detroit is very close to us here in Columbus as well. So trying to get them out to those hot spots as quickly as possible. And like you said, hopefully every city in America will have one and be able to do this sanitation process to make sure our doctors and nurses stay healthy themselves.
Christine, live from Columbus, Ohio. Thanks so much. Appreciate you taking the time. If you have questions about COVID-19, we're going to be sitting down with doctors to get some facts for you, some answers. We're going to answer some of the key questions about the coronavirus. Email us coronaquestions@nexstar.tv, coronaquestions@nexstar.tv. Your question may be chosen. They're going to be answered Saturday and Sunday on our websites.